What began as merely an idea quickly became a shared vision between Indiana University and IU Health. A vision that evolved into fulfilling a promise to bring innovation to healing, wellness, and education, all to benefit the people of South Central Indiana and beyond. That initial vision has grown into plans for IU Health Bloomington and the Regional Academic Health Center, a first-of-its-kind project that will boldly break new ground.
So not only are we celebrating today the groundbreaking of this new facility, we're also celebrating really a groundbreaking of the way that we are going to approach a very patient-centric care model.
Another groundbreaking event for us is really bringing together these two large organizations in South Central Indiana, IU Bloomington and IU Health, bringing our educational programs right next to the clinicians and the practitioners that are going to be right there in the hospital.
I think as we have this opportunity, it's a once-in-a-lifetime chance to be able to build a regional academic health center that will provide wellness and illness care for our patients. And to get that right, that means something to all of us, because we're patients as well.
When you have a presence that will be that visible on Route 45, 46, and it raises the profile both for the practice of medicine and what the hospital wants to accomplish, but also for academics. And when you have that sort of thing going, your ability to connect with the community and serve the community, I think, should increase.
I think one of the most important groundbreaking events for us is the co-siting of 4 of our programs in health sciences together in a single building. And this will help us to realize a vision for interprofessional education of our students, where we co-train them together.
If you're rubbing elbows with people and seeing what they do, and it could only benefit us, and having a better understanding of that, and being collaborative, coming up with new ideas and new programs, and kind of feeding off of each other, and we work together in the real world and the hospital side, so it seems like a good idea that we would start that early and work together in the education side as well.
It provides for a higher learning experience, not necessarily saying that the students will learn more, but they'll learn more in the aspect of professional development. They'll be able to work together. They'll be learning together. When you go to the hospital as a nursing student, I have to say, you're surrounded with your other nursing students who are also learning, but then you know you have these people who have already done this and they know so much. And I think it provides for a more comfortable learning environment for people to be able to be around other students as they're learning.
This is a tremendous opportunity to really put an imprint on healthcare from this generation and for future generations. It will be an opportunity to have a very robust healthcare system, to create new models in patient care that will address some of the pressing issues that we face in this particular region. We will be able to bring the team of providers together in a way that we haven't in the past. And I think we will have a tremendous impact on health outcomes.
From a patient's perspective, this campus really gives them the opportunity to feel confident that they don't have to go other places to get state-of-the-art care. We'll be able to deliver state-of-the-art medicine right here in Bloomington. This patient-centric model will allow us to care for you despite how sick you are in the same room, so that you and your family and your loved ones will not have to be transported through the hospital to different areas. Rather, the hospital will flex to the level of care that you need.
The care will come to the patient. The patient won't have to travel, they'll stay on the same unit. And so really what this allows the nurse to do is have the expertise and the education and the training to provide that care to the patient. It's a continuity of care. It's the same nurses caring for you that know you and have developed a relationship with you.
So what happens in an environment like that is you create the momentum, you create synergies, you create the conditions to innovate, to change things.
Well, I think that there's a great opportunity for a wide variety of our programs in Bloomington to benefit from this project and to become associated with this project in a lot of different ways. Beyond the health sciences, I mean, it's long been recognized that music and art has great healing powers, and I think the wellness focus on the campus fits in very well with our connection with those strengths of the Bloomington campus as well. The students will be able to tell us whether their experience is now providing them with the kind of training that they anticipate and want and need to be able to go out and be practicing professionals. I think we'll see that in the way they interact with one another, the way they interact with the facility, the way they interact with their faculty and the staff that are in the building, and with the way in which they interact with their clinical trainees in the hospital.
The new facility, it's kind of like saying that healthcare here in the community is valued, and hopefully will attract and continue to attract good people to want to work and live in Bloomington.
I would love to come back and teach at my university, so that would be an option for me. You know, I would come back and possibly work at this hospital because I want to come back and I would like to give back.
And when we think about a regional academic health center, this is going to be a destination place for nurses to want to work and for patients to want to seek care. As we partner with Indiana University and we have the benefits of research and the educational opportunities with the School of Medicine, with the School of Nursing, all of that coming together will allow us to have the opportunity to provide the best care we can to our patients throughout the communities that we serve.
Indiana University and IU Health. Together, we're breaking new ground in
Research and teaching.
Health sciences education.
In the field of medicine.
But most importantly, we're breaking new ground in how we care for you.